Hello everybody, I'm Dr. Vaibhav again. So today I'll be talking about H3N2. So let us understand what exactly H3N2 is, what kind of a virus it is, and what are the symptoms it causes in humans. So to begin with, to get a basic understanding, H3N2 is a subtype of an influenza virus. So this particular type of influenza virus is actually the ones which affect animals, to be specific, pigs. So if you've heard of the other terminology, which is H1N1, which is also prevalent quite a few years back. So it is similar to that virus in a subtype, so even that used to affect pigs. So this particular virus, which is H3N2, was detected in the early 2000s somewhere in the US, where it was usually affecting the pigs. So the cross infection between humans and the animals happened because of droplet infection. So that is how the infection, usually a viral infection, spreads even from one human to another. So H3N2, you might be wondering why this name is given. So it is because of the surface proteins which are present on the virus. So to be specific, it is called hemagglutinin and neuraminidase. So because of these, the particular name that H3N2 is given to this virus. So now let's look at how this infection spreads from one person to another. So like I mentioned previously, this infection is a droplet infection, so it spreads in the form of droplets. So it can be the form of coughing, or if you're in close contact with the person who's infected by coming in contact with the person's droplet or spreading infection. So that is how the infection basically spreads. So now let's look at who are the people at high risk at contracting this infection. So the people usually above the age of 65 years, and the people who are, the infants, that is children below 1 year. So these are the high risk people, and along with these, any people suffering from chronic conditions. So chronic conditions could be chronic lung conditions like asthma, COPD, or any lung infections, or it can be other chronic infections or chronic heart conditions, chronic kidney conditions, or people on immunosuppressants therapy. So these are the people who are at high risk of developing these infections. Okay, so now let's briefly look at what are the symptoms. So the symptoms of this particular infection is similar to any other flu infection. So it starts with your upper respiratory symptoms like your sneezing, running nose, sore throat or throat itchiness, and it can progress to your lower respiratory tract, which form symptoms like cough, breathing difficulty, wheezing, and fever also. So of late, this particular subtype of influenza has been a concern because of the rapid number of cases which have been rising, especially even in children. So a lot of people coming in with the symptoms which I mentioned earlier, which have been persisting for a long period of time. When I say long period of time, it could be like more than 2 weeks. So cough which is persisting for more than 2 weeks, or the symptoms which is not relieving on medications, could be an indication that it could be a viral infection, particularly a H3N2 infection. So now let's look at how we go about diagnosing this condition. So mainly diagnosing a viral infection, especially in the respiratory tract, is based on symptomatology. So based on the symptoms of a person, we can get an idea that it could be a viral infection. Then there are some basic tests which we do, like the chest X-ray to begin with, and a few blood tests which give us an idea that it could be the viral infection. So now once we have diagnosed this infection, let's look at how we go about treating the condition. So a treatment of any viral condition is quite a tricky situation because there are no particular antiviral drugs. So if you all are aware, you might be aware of the antibacterial drugs or antibiotics which we give to treat bacterial infections. But in case of a viral infection, there is no particular antiviral therapy which is targeted against a particular virus. So the treatment part can be a little tricky. But the good news is that most of the viral infections are self-remitting, or if your immunity is good, it is self-remitting. So the treatment would be required more so in people with a low immunocompromised state. So now let's look at some of the measures which we can take to prevent this condition. So the prevention of any viral infection is similar to each other, like if you are aware of the COVID situation also. So the similar precautions can be taken in preventing any viral infection. That is wearing your mask, keeping safe hygiene, maintaining social distance, avoid crowded places, avoid too much smoking. So these are the basic precautions which can be taken to prevent any viral infection. That stands good even for a H3N2 infection. So when you are facing any of the symptoms which I mentioned, please do not self-medicate. Do visit your doctor, especially if you have an underlying condition or if you have symptoms which is lasting for a longer period of time. Do consult your doctor and get treated. So talking about vaccinations which are targeted against these viral infections, these vaccinations are targeted against a particular infection and not the subtype. So the vaccinations are also prepared on a yearly basis to assuming that there could be a subtype which is causing the infection at a particular rate. So it is quite safe to take these vaccinations, and over a period of time there are data which proves that the vaccination also helps in preventing complications of infections. So if you especially fall under the immunocompromised state or at the high risk patient category, please do visit your doctor and take the vaccination, and which will prevent you in getting the serious infections. So thank you once again for listening. Hope that information was helpful, and see you in the next video.